once the diagnosis is made, then most hospitals or doctors would refer the baby to an organisation like the Cerebral Palsy Alliance, where there's a 65-year experience in looking after children and families who have a child with cerebral palsy. And that will come in many forms. There's social work support, psychological support. There can be also occupational therapy, physical therapy, help with equipment that's very expensive and very important. And also families can meet other families who have children with cerebral palsy. Often parents actually know what's around and they can guide each other.
They need to be provided with, firstly, ideas how to promote their child's development and what to do with their child. So what to do with their child maybe simple things like how best to play with their child, how to feed their child, how to have the child in the most appropriate position for play and for feeding. They might need a lot of practical advice. But early childhood intervention is much more than that. It's helping the parents understand all about cerebral palsy. So it's giving them all the information so that they know just as much, or that they will know more, in fact, than the health professionals, because they know their child best.
A social worker came out to my house, and just to get to know me, to learn a little bit about my family, to understand what Will's situation was, because cerebral palsy affects children so differently.
We also contacted the local council when we got some carer respite, and we got a carer in to help from time to time. But it wasn't really till we locked in with our physiotherapist that we started to understand all the other options available to us, and all the other therapies that come into play, like Botox, casting, orthotics, surgery, all the bits and pieces that there's a lot of little bits that you've got to bring together to form the overall care plan for someone with cerebral palsy.
The treatments are many and diverse. First of all, it's very important that we treat any associated health problems. So the children may have difficulties like constipation or nutritional problems. All those issues must be addressed. Any associated difficulties such as problems with vision or hearing must be thoroughly investigated, and if the child needs glasses or hearing aids, those must be supplied.
Things that you need to think about are what will they need in the form of early intervention, so occupational therapy or physiotherapy. We know that if children are given therapy that helps them function in their own home, that can be more helpful. Or if they can be taught to feed themselves. So we ask the parents and the children, what is it that you want for your child? And something they can do within their home is very important. You know, dressing themselves, feeding themselves. So what we call goal-directed therapy.
The physiotherapist will guide me through the motions of how to transfer Will, so how to get Will from sitting on the floor to standing without just lifting him, or how to safely transfer Will from his car seat into his wheelchair, so I don't hurt myself, and also so Will is kept safe as well. In Will's case, we teach him how to transition, so it's because he has the potential eventually to grow and get stronger and learn how to manoeuvre himself in and out of the shower or the bath or his car seat. And so rather than just constantly lifting him from A to B, we show him how you would move.
With Kinnan at home, we do a number of activities that are centred around his CP. We try and get him to walk to school or part way to school a couple of times a week, because it's also about getting his endurance up. I mean, the rule of thumb that we've been given is that for Kinnan to walk one step, it's the equivalent of someone else walking 4 steps. He also has to take medication for his seizures, and then there's work we do with the speech therapist at home too to help develop his learning skills as well.
We did leg massage every day because the ataxic CP makes his muscles very tight, almost like steel cables. So you have to massage that out, it's very painful, which is why we need a wheelchair on long walks, because his muscles seize up.
We believe that the earlier that therapy is provided, then the more it can affect the recovery of the brain, because we know that babies' brains actually are changing all the time, and that they have benefit from something called neuroplasticity. That means that their brain can change, develop, and other areas of the brain may take over. So it's very important to get in early.
As far as support goes for my husband and I, we have a fantastic family who are very supportive of us, but family still sometimes isn't enough, and definitely connecting with a group of people, whether it be through an organisation such as Cerebral Palsy Alliance or whether it be through school. It's so vital to create relationships with people that understand, that are going through the exact same thing.
You can't get enough support from other parents. You've got to know people, even possible family counselling, relationship counselling, because it affects you. If the parents aren't strong, they can't look after the child.
The future for children with cerebral palsy is changing all the time. We're not just looking at research into prevention and cure. In fact, most of the research at the Cerebral Palsy Alliance has been focused on finding the best interventions to help children fulfill their best potential.
I just hope that my husband and I and all of our family and the therapists that work with Will, that we can arm him with the opportunity to have a fulfilling and the most independent life that he possibly can, in the same way that we have that plan for his older brother. Will's rite of passage through adolescence into adulthood will be very different to that of his brother, but he deserves that every step of the way, and we just need to guide it a little more for him and be his advocate so he can really just have a fulfilling life. And what that means for Will is different to the next child and is different to the next child. It's there's no normal anymore. It was very important once, but this is just Will, and we just want him to have a great life and to enjoy everything that it can bring him. And we'll be there to support him along the way, and I'm sure there's going to be a lot of tears along the way, but there'll be so many wins as well, and I look forward to seeing him grow.